Hello, everyone. My name is Sean, and the topic that I'm going to be discussing is osteogenesis imperfecta, or OI. And this is my table of contents of some of the things that will be covered during this presentation. So a little bit about osteogenesis imperfecta. It's also known as brittle bone disease, can be characterized by fragile bones, high reoccurrence of fractures for individuals, bone deformities, and short stature. The occurrence of the disease is typically between 1 out of every 15,000 to 20,000 births, and severe cases have a large impact on one's ability to accomplish occupations and activities of daily living. A little bit more about OI is the causes. It's a mutation of either ACOL1A1 and or CLL1A2, which encode type 1 collagen. These mutations are going to cause structural deficiencies of that type 1 collagen, which impacts connective tissue and cartilage. Diagnosis can be done by either genetic testing, which can be due to family history. So, parents having a child, one of the parents may have a family history of OI, and that would be a reason for getting a genetic test done. Timing is dependent on the severity. It can be diagnosed through pregnancy, first and early second trimester with an ultrasound. It can be diagnosed after birth, in adolescence and adulthood. It's very important for physicians to have an accurate client history to rule out any other health issues and to ensure that it is in fact OI that they're being diagnosed with. So for classifications of osteogenesis imperfecta, there are technically 5 classifications. The 5th classification has been discovered in more recent research. So the first classification is mild. The mildest version is just blue sclera. That is the white portion of the eyes are tinted blue. So they're not really showing signs of bone deformities or anything like that. The second classification is extremely severe with high risk of fatality before birth or through the first year of life. For the third classification, it's most severe occurring after the first 4 weeks of life with severe deformities and very short stature. The fourth classification is mild to moderate and shows mild to moderate bone deformities and stature with no blue sclera present for these individuals. And then that fifth classification is for individuals that have the calcification of the interosseous membrane. The first source summary that I did was off of Sparse Shaw. He's 13 years old. He, at the time of doing his TED Talk, he was born with over 35 fractures throughout his body and has accrued over 130 fractures within his life. So he discovered a love for music and has trained in Indian classic music. He was very impactful with his speech, talking about his experiences from having the disease and the impacts that it had on his life. He lives his life according to 4 main rules. One is find your passion. 2, do not hold yourself back. 3, help others. And 4, dream big. He uses these rules to keep himself motivated and to do things in life and not let his disease kind of rule him. He's very optimistic, and the support of his family has led him to where he is today. And I added a little quote from him during his TED Talk, and it says, "No matter what happens in your life, you should never ever give up on your passion." And he really did display that. The second source summary was of Maria Larson. She did a TED Talk discussing the effects of OI on her life and how it was discovered for her during a hip range of motion test when she was an infant, which resulted in multiple fractures. Had a lot of impacts on her and her family adjusting to her having this disease, but she's very optimistic, and her whole goal in life is to live and enjoy life and to be in the middle of life and to not let the fear of broken bones prevent her from doing that. The third source summary that I did was on Jody Owen. She had a lot of influential things to speak about. She's very independent, driving on her own with her wheelchair, all these different things that she is able to do, even though she has osteogenesis imperfecta. It really had a lot of impacts on her family, her parents' marriage, and even her brother psychologically because of the attention that was given to her. So it really showed more of a psychological side of it with her interview. So, some key takeaways that I had from these sources for the disease and the diagnosis is that it has severe impacts on one's ADLs and IADLs. Everyday movement, such as dressing, can lead to certain fractures as well. Diagnosis can be found before birth, but can be discovered after due to multiple fractures during delivery, even during assessments. Clients with OI can experience multiple sustained injuries at once, so treating patients is very important to be mindful of that. Clients may be severely injured by minor accidents or falls that we wouldn't expect others to be injured from. And psychological issues of depression may occur due to isolation and limited socialization. So that mindset really equals motivation, and it's very impactful for them to be successful throughout life. Assistive devices are used daily for those with a severe form as well. So informed clinical reasoning for future practice. Just a couple key points that I think stood out for me were understanding the disease, knowing the signs and symptoms of that disease are going to be very impactful for treating patients, knowing severity of the disease and how it impacts them, and those psychological aspects that were discussed on the previous slide. ADLs and IADLs are probably the most impacted things for clients with osteogenesis imperfecta. So being able to help them do those ADLs and IADLs should be a really big goal. Impacts on treatment are going to be a high risk of fractures during interventions. Focusing on those ADLs, IADLs, and models or frames of reference to use would really be the MOHO biopsychosocial model, the PEO, person, environment, and occupations. Settings that you'll see these in most likely, I think, are going to be the acute care, home care, and skilled nursing facility. And these are my references.